Welcome back to the Poultry Doc Podcast. I'm your host, Dr. Blayne. In today's episode, we're looking at a possible Mycoplasma outbreak. We'll walk through real-world Mycoplasma testing and how to test your flock all by yourself. Don't forget to peck that like button, subscribe, and share. Let's get into it. Welcome back to the Poultry Doc Podcast. I'm your host, Dr. Blayne, and today we're at Sarah's house, and Sarah's been dealing with some issues with her roosters. She's described some redness of the eye, maybe potentially tied to a respiratory issue, and she's been treating with terramycin, some eye ointment, and saline wash to help with that, but she's still having issues, and the roosters are still having issues, so she's worried about those.
I don't know for sure, but a few months back, I brought home some Polish roosters that I found at the feed store. They have them that you can adopt, and I think because I couldn't see his eyes, I think it's where the issue started. So now I checked his eyes, it's really obvious he's one of the ones that's sick. But what I first noticed was one of my roosters had been sneezing, so it lasted a week or two, and then his eyes started turning pink, and he became really lethargic, stopped eating, so I quarantined him, and his eyes have been getting worse and worse.
So, just the stress of a move, kind of bringing new birds here, introduction of the birds that you already have, that can cause stress, which can bring on a number of issues, right? And so one of the things that comes up is Mycoplasma. That's definitely a concern, especially when we're introducing new birds. The redness in the eye, that could be something too. Did you hear any respiratory issues or?
The sneezing?
Yeah, the
but
sneezing.
that's all. I didn't
okay.
notice
no,
raspy
gurgly. Okay. Those can all be signs, and Mycoplasma can show up in various different ways. And there's two really types of Mycoplasma that we're concerned about. Mycoplasma synoviae, which is not as bad, but still causes respiratory disease and some joint issues. Sometimes people see that, sometimes they don't. And then Mycoplasma gallisepticum, MG is another way we call that. And it's more severe usually. And especially, you mentioned you had some turkeys that you tried to hatch with.
They were in with this main flock. They weren't with the roosters.
Yeah,
so I have like two main and a bachelor flock.
Okay. And then, but the turkeys didn't do well.
No, they made it to maybe 4 weeks, 6 weeks old, and then they just started dropping one at a time.
Yeah. Did you notice any clinical sign or any signs in those that?
Not a lot. Like they look tired for a couple days before.
So Mycoplasma is more severe in turkeys than it is in chickens, and so that kind of another potential, it could be Mycoplasma. So one of the things we're going to do today is a diagnostic that we have at the Poultry Doc that we're kind of in the testing development stages of, and it's a mouth swab, and then we're going to wipe that onto a special kind of card that preserves DNA and RNA, and then we'll go back and we send that card to the lab. And they test for Mycoplasma there, and they can tell us which one it is, and then that gives us some direction on how to treat for it too. So let's dive in and look at these birds.
Roosters.
Yeah.
But the sick guys are in here. So we had just the coop and no run for a while.
We get to run around outside or no?
No, all of mine stay inside. Yeah.
Too many.
Two predators. Yeah. So this is Herkimer. He's the main rooster, but he used to be much bigger than everybody. So these guys are about to outpace him. I don't know if they're going to take over. This guy, he just doesn't feel good at all. It's hard to see.
Is he trying to feel his breast? Yeah. So they've lost quite a bit of weight.
He is not. I think maybe he's just been bad for a while and didn't notice.
Yeah. So Sarah, we've got two roosters here, two of the affected ones that you described with the eyes, and you can see we've got swollen eyes. They're closed. Just by feeling these birds, they've been sick for probably a little while where we've got a significant loss in condition, so I can feel the keel bone quite a bit. So, they probably haven't been eating very much. Drinking, it's probably hard to tell exactly what's going on because you've got quite a few. But, so remind us again, when did you notice these symptoms come on?
It's been maybe 2 or 3 weeks since I really started noticing him get sick, and I suspect he was already sick.
Okay. So when I heard him breathe a little bit, it was a little rattly. They're both depressed in terms of their activity. They're not jumping around. They're obviously not making noise. They don't feel very well. So my suspicion, again, would be that there's likely some Mycoplasma going around in the flock. When you picked up birds, it's totally common. Pick up bird from one place, you have the ability to introduce that disease or any disease into a flock. So probably want to test for Mycoplasma, and in the meantime, we can do that. We can run that test here, and I can show you how to swab for it. Right now, we're looking at Sarah's rooster. He's been affected for a couple of weeks. He's lost a lot of body condition. He's obviously sick and not feeling well, very depressed. My thought is that he has Mycoplasma, and we want to confirm that so we can give him the appropriate antibiotic to help him recover. And what we're going to do is take a swab. It's of his choanal cleft, which chickens have a natural cleft palate, basically, and so it's a slit in the top of their mouth. So relatively simple, tear the end of the swab off where you can feel the swabs on one end. So the cotton swab's on one end, stick end on the other. Tear the stick end off. You can use your index finger a little bit, just like that, to hold his mouth open. Try not to touch the swab to anything else. It won't be absolutely terrible if you did. Okay, so we're gonna take our swab. It's really simple as that. You don't need very much. So, there we go. Now we've got enough material on here. Like that may have been a second or two worth of swabbing. Next thing we're going to do, the kit is going to come with the card. This is a FTA card. Roll the swab around. You can take multiple swabs from different birds in the flock. We'll call this a pooled sample. So we took one from him. We'll take one from the Polish rooster as well. And again, we'll use a new swab. So we've got several swabs will come with the kit. You're going to use a new swab for every chicken that you want to take. And then just rub it somewhere in the circle. And yeah, Sarah is going to attempt, you're going to swab the bird. Now what I'm going to do is basically what I did the way I did it, and just hold, I'm going to take my thumb and my pointer finger. Is that what that is? Thumb and pointer finger, and I'm just going to hold his mouth open while she takes the swab into the roof of the mouth and gives it a twist or two and collects the sample. And again, there's not much to it. I say 3 to 5 seconds, it's 1 to 3 seconds. It's really, if you get the material on the end of the swab and if you're in that choanal cleft, you're going to get the material that you need. And you'll see the cards change color from the last time. And so yeah, we're just gonna roll it around on there. It doesn't take much. So if you get a little bit of color change or a little darkening where it was moist, that's what we're looking for. So it doesn't take much at all. Okay, so today we visited Sarah's flock and we looked at our a potential MG case, and the birds are pretty severely affected, so we're going to go ahead and put these birds on an antibiotic. At the same time, we're going to run a test just to confirm that she does have Mycoplasma. So MG is what I'm thinking this probably is, Mycoplasma gallisepticum. Again, we'll follow up in a couple weeks. Hope we turn things around here. Till then, we'll see you again. Share this episode, save it, and tell all your friends. Thanks again for joining. This is the Poultry Doc Podcast, and I'm your host, Dr. Blayne.